What is sepsis?
So sepsis is caused by the body's overwhelming and sometimes life-threatening response to an infection. So first of all, there has to be an infection, and not every infection leads to sepsis. But when it does, what essentially is happening is that the body is releasing chemicals into the bloodstream, part of its attempt to fight the infection, but those chemicals end up inadvertently creating so much inflammation. It's kind of inflammation run amok. And what that inflammation can then do is affect blood flow to some of the vital organs, which can really start to lead to a lot of damage.
So does it cause shutdown of some of those vital organs sometimes?
It can. There's a spectrum of sepsis. So there's anything from mild sepsis to something called septic shock, which a lot of people may have heard of. And so what essentially is happening in septic shock, the word shock implies problems with blood pressure. And so that process, that inflammation run amok, has gotten so severe at that point that even with intravenous fluids and even medications to support blood pressure, we're having a hard time maintaining somebody's blood pressure, and then the organs just start failing.
How common is sepsis?
So it's actually quite common. It's much more common than most people realize. So if you think about in the United States, a rough number would be about 1 million cases a year.